meningitis in children. Bacterial meningitis is a severe, life-threatening infection of the central nervous system that requires immediate medical attention. Even with appropriate treatment, morbidity and mortality can be substantial. Meningitis can be acute or chronic. Acute bacterial meningitis has a relatively rapid onset of symptoms. Chronic meningitis involves ongoing signs and symptoms of meningitis for 4 or more weeks without clinical improvement. Causes of acute bacterial meningitis: Streptococcus pneumoniae, Neisseria meningitidis, Haemophilus influenza, Group B Streptococcus, Listeria monocytogenes among others. Streptococcus pneumoniae remains the most common cause of acute bacterial meningitis for children older than 1 month. Group B Streptococcus, Escherichia coli and gram-negative bacilli are the main cause of acute bacterial meningitis in neonates, babies less than 1 month of age. These organisms are usually acquired from the maternal genitourinary tract. Other causes of meningitis include Herpes simplex virus 2, Varicella-zoster virus, mumps virus, HIV virus, TB, fungi among others. Risk factors for meningitis in neonates include preterm birth, low birth weight, chorioamnionitis, infection of placenta, prolonged rupture of membranes, traumatic delivery, fetal hypoxia, urinary tract abnormalities. Risk factors for meningitis in older children include asplenia, absence of spleen or loss of its function, HIV, sickle cell anemia, cochlear implants, cerebrospinal fluid leak, recent upper respiratory tract infection, head trauma, lack of immunization. Signs and symptoms of meningitis in children: fever, vomiting, poor feeding, inconsolable cry, jittery, weakness, convulsions, neck stiffness, bulging of fontanelles. In older children, they will have headache, lethargy, confusion, photophobia, nausea, vomiting, back pain and neck stiffness. Treatment of meningitis: painkillers and antipyretics for fever. Antibiotics like ceftriaxone, cefotaxime, ampicillin, vancomycin, cefepime, meropenem etc. Complications of meningitis: hearing loss, cognitive and developmental disabilities, epilepsy, paralysis, blindness, hydrocephalus, diabetes insipidus, hypothalamus dysfunction. Prognosis of meningitis: mortality rates between 5 to 15% in all children. Infection caused by Streptococcus pneumoniae is associated with poorer outcome. Prevention of meningitis: 1. Vaccination, meningococcal vaccine, Haemophilus vaccine, MMR vaccine, pneumococcal vaccine. 2. Good personal hygiene. 3. Avoiding people with meningitis. 4. Avoid overcrowded places,